everyone, welcome back to my vlog, A Dose of Reason. I'm Dr. Shira, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Our first question comes from Sully from Southie. Now that the Omicron variant is here in Massachusetts, what precautions should we be taking to stay safe? Should we be doing anything differently than before? Well, Omicron is a potential threat for the future. But Delta is a real threat right now. You know, there's a lot of COVID out there, and it's pretty much all Delta. So if you're not vaccinated, you're not safe right now. The Massachusetts wastewater data suggests there's more COVID circulating right now than ever. It's hard to believe, and I don't even really understand it, but you do not want to meet this virus without at least some immunity. And because a variant that has immune escape potential, which sounds like this one will be, can be controlled by high levels of immunity, getting a booster is now more important than it was before. It's also really important to stay away from others if you're sick and to get tested immediately, even if you're vaccinated. And wearing a mask indoors is still a great way to protect yourself, and it's especially important if you're older, have underlying medical conditions, or live with someone who does. Our next question was sent in by Mandy from Taunton. I want to get my COVID booster shot, but I'm currently on antibiotics for a bacterial infection. Is it safe to get the booster while on antibiotics, or are there any concerns? Yes, Mandy. There are almost no scenarios that make it unsafe or ill-advised to get a COVID-19 vaccine, whether it's your first, second, or third shot. If you have active COVID, please don't go out in public and get a vaccine. If you have another communicable disease, please wait until you're no longer contagious. If you had an allergic reaction to a prior COVID vaccine, in many cases, you can even get the same kind again, and in other cases, you should get a different brand. So ask your doctor about that. Otherwise, come on down. We actually have a walk-in clinic at Tufts Medical Center. Even if you just got another vaccine, you can get a COVID vaccine. Even if you're taking medications, even if you just got a bad haircut, everyone is welcome. Our last question comes from Jose from Cambridge. I was fully vaccinated with 2 doses of the AstraZeneca COVID-19 vaccine at the end of June before moving to Cambridge from Spain. My doctor in Spain told me that people vaccinated with AstraZeneca are eligible for a Pfizer booster shot after 3 months. Is this true? Can I get my booster shot now? Well, Jose, the CDC actually says that people who receive both doses of AstraZeneca vaccine can get a Pfizer booster at 6 months after the second dose. It's thought that the AstraZeneca vaccine, like the J&J vaccine, which is made using the same technology, may provide more durable, long-lasting cellular immunity. Cellular immunity is the immunity that's most important for the prevention of severe disease, hospitalization, and death. So while antibody levels wane over time for all vaccines, that mostly affects protection against asymptomatic and mild disease. You're probably well protected against severe disease until you can get your booster later this month. That's all the time we have for this week. You can send me your questions about the pandemic, this year's flu season, or anything else related to infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.